Mentorship is the lifeblood of our profession. It's not just about teaching technical mastery and economy of motion, but also it's about instilling vital personal skills like discipline, perseverance, and courage.
So look, my name is Peter Skillington. I'm a cardiothoracic surgeon who's worked all my life at the Royal Melbourne Hospital. And today we're here at the Royal Australasian College of Surgeons building in Melbourne, having in the middle of a training day for trainee cardiothoracic surgeons. And today we're in fact fortunate enough, because of some funding that was available, to be able to have cadavers. Even though the pig hearts, etc., are quite good, they're not exactly the same as a human heart.
So I'm Dr. Stephanie Wayne. I'm a cardiac surgeon here in Melbourne at Victorian Heart Hospital. And I first did this a few years ago when I was a registrar, and now I'm a first year consultant. Doing cadaver training earlier as a registrar, I was able to learn more basic principles, and that helped me going forward in terms of foundations. And what I really found useful today is, now that I do understand the principles, understanding more the nuances. So with a specific procedure, how to get my assistant to assist me in the best way. Do I take this stitch forehand or backhand? You know, avoiding common pitfalls. So really the more nuanced things that has been exceptionally valuable, especially from the really experienced surgeons.
Been fantastic. Using the cadavers has provided a really realistic experience, much more so than previous wet labs that I've done, which have been helpful, but this provides another level of realism and simulation.
From an industry point of view, it's a low pressure environment. We're able to provide all the latest technology that they would normally have options to, but there's no pressure on outcome. They get to see different features and benefits from what happens with different product. It's just a really important environment for them to actually get exposure to across multiple different learning outcomes as well.
Not only for the individuals using the products, but also for industry, seeing the products being used by different surgeons, proctors from around the world. It's great for us. Also, there's a benefit for us to see our products being used by different people and having different perspectives on things.
It's a privilege to be involved and help other surgeons to achieve their educational goals from A to Z, I would say. So it's a collective effort by senior surgeons in the country to pass on the knowledge to the younger ones.
And I find it, I want to train people and support people who will be to take the subspecialty area forward. And you need to support the trainee and then establish and develop further to the state that then at one point table turns and you learn from your trainees that now establish and developing further.
This mentoring of trainee surgeons by senior surgeons is a very important role, and in this setting, which isn't in the real operating theatre and there's not a patient's life at risk, the surgeon is generally less tense and more able to explain all the intricate steps of the operation. The other important aspect has been the support by industry and by donors and from the College of Surgeons itself to make the training space available in their schools laboratory. So it's really been a perfect environment to do this training, and I think it's an invaluable resource, and I think it can only lead to having better, well-trained surgeons in the future.
We often refer to the metaphor standing on the shoulders of giants because we know we have greatly benefited from the vision, courage, and sacrifice of the innovative surgeons that have preceded us. Their enduring legacy not only inspires us, but also galvanizes our unwavering commitment to mentoring and shaping the next generation of heart surgeons.
2, 1.